This was announced by the Regional Director of the Effiankwanta Regional Hospital, Dr. Joseph Tambell, as the hospital marked this year's celebration of the Universal Health Coverage Day. Dr. Tambell assured patrons of the hospital, especially patients of the breast cancer unit, that they will no longer need to travel long distance out of the region to seek medical care. This is because, aside from now focusing on the operationalization of its breast cancer treatment unit to take up cases which hitherto were referred to Komfanochi Teaching Hospital in the Ashanti region or to Kolebu Teaching Hospital, they will soon have available the much-needed cancer drugs. This would go a long way to reduce their cost of treatment due to the travels.
Apart from the fact that we've set up a breast care center and that we're doing a lot of mass screening in the communities, I'm also happy to inform you that our mammogram, which has been out of service, in fact, it's never worked before. It was installed somewhere in 2014. It's never worked, but I'm delighted to inform you today that in a matter of weeks, this mammogram will be working. I'm also delighted to inform you that we are very soon going to start the prescription and dispensing of cytotoxic medications. Those are the cancer drugs for people who have breast cancer.
The second major cause of death in women is breast cancer. It is thus important to emphasize the need for early detection. Fortunately, the hospital's mammogram, which has not been functioning since 2014, will soon be working. In all of this, the hospital has chalked some successes in the management of breast cancer cases. He highlighted some of them.
There's no area that preventive health is more important than in the area of breast care. We all know that breast cancer is currently the second highest occurring cancer amongst women in our community, and it's also the second cause of cancer mortality, not only here but I think in the entire country. And as such, we felt that we should highlight this issue of breast cancer, especially that we are in the month of October, and October is the month for breast cancer awareness. We started a breast care center in the latter part of last year. I'm happy to say that the center has been very active. We've done a number of community outreaches, and then we also are doing screening on the compound. As of June this year, we have done over 700 internal screenings. We had done over 1,000 screenings outside the hospital premises. And of this number, 366 were referred for mammogram. And of this, we're able to detect 32 cancer cases. And I must say that these are 32 lives that we are helping to protect and helping to prolong. And I believe that we can do a lot more. As the center gets more resourced, we believe that the output will be bigger.
Dr. Nana Esigezi, the chairwoman of the planning committee, also urged the public to bear with the relocation of certain services to other areas as part of the redevelopment of the hospital.
This is an opportunity to showcase the redevelopment plan of our hospital, and so that's why we are mounting the screens to show us what the Effiankwanta is going to look like in the next 2 to 3 years. It's also an opportunity to let us know that we haven't closed the hospital just because some parts have been broken down. We are still working, and you can see our staff around. We have only relocated our services, and we have flyers and signages. So when you go out, please tell everybody that the Effiankwanta is still working, and we have only moved certain services from one place where they usually were to a new place.
The project, when completed in the next 3 years, would add 500 beds and provide a one-stop shop for all healthcare services. The Open Day ceremony to commemorate the World Universal Health Coverage Day also provided free medical screening to the general public. It was on the theme, Early Detection of Breast Cancer Saves Lives. For Assassin News, my name is Isaac Hughes, reporting from the Western Region.